Hello, hello. Thank you to everyone who's joining us for our annual Women Empowering Women virtual event. Whether you're tuning in on Facebook Live or Zoom, we are so thrilled to have everyone here with us today. My name's Katelind Groenhagen. I'm the VP of Sales at Propel Orthodontics. And in the interest of time, I'm going to give a quick little introduction for each of our amazing panelists. So doctors, if you can, please give a little wave when I introduce your name for our viewers, just so they can match each of you up in case they don't already know. So going in order of how you all appear on my screen, we'll start with Dr. Yael Frydman, practicing in Massachusetts. Thank you for joining us.
Hey.
Dr.
Thanks for
Kristin.
having us.
Of course. Dr. Kristin Huber joining us from Atlanta, Georgia.
Thank you.
Yeah, Dr. Liliya MacKenzie joining from New Brunswick, Canada.
Thank you.
Yes, thank you. Dr. Regina Blevins joining us out of Minnesota. Dr. Jonelle Crichton, sorry, I knew I was going to mess that one up, out of Alberta, Canada. Thank you so much for joining us today.
Thanks for having us.
Of course. And Dr. Melissa Shotell out of California. So thank you all so much for joining us today. And as many of you know already, this is a fantastic group of talented orthodontists, business owners, leaders, and of course, strong women. I'm so thankful that each of you carved out some time for us tonight so that we could chat and get together. This month marks our second anniversary of Propel's Women Empowering Women initiative. Some of you may recall we had our first live event at AAO 2019, back when we took in-person events and we could all get together in large groups, and kind of took those for granted. And masks were only used in the clinic and not everywhere. So at that time, we were pleased to bring together over 70 female orthodontists for an open forum discussion led by our panel, Dr. Regina Blevins, who is joining us here today as well, luckily, and Dr. Donna Galante was there as well. And we also had Dr. Esther Feldman, who were leading up our panel. And if I recall correctly, the appetizers and cocktails were quite delicious also. Then as we braced for the pandemic, we decided to take our efforts into a digital direction, broadcasting a number of happy hour events and smaller group discussions focused on creating a support network for women leaders in orthodontics, where we exchange ideas, experiences, perspectives, tips, and even some quotes. This is our Women Empowering Women Propel Orthodontics mug. And needless to say, all of these events have been so very meaningful and rewarding to me, and I hope they've touched other women in our industry as well.
Yes.
They've also been quite a bit of fun. Sometimes we have wine, and we always have quite a few laughs. And as restrictions are lifted and in-person events can resume safely, we hope to expand this initiative because I think we all know how important it is to work together and lift one another up. I'm going to pull up my screen again. There we go. Thank you. Had to see all of your faces. So before we get into the panel discussion, where I will finally take a break from talking, thank goodness, I thought we'd try a little poll for our Zoom attendees this time. Facebook viewers, please feel free to write in the comments for what your decisions are in the polls. I know time is precious for all of us, so I'd like to see which topics our attendees are most interested in hearing about tonight. So we'll have you guys start pulling those out. Our topics, for those of you who maybe can't see them, are empowerment, clinical, business and career, pandemic, region status, as well as restrictions, and technology. So we'll give everyone another minute or so to kind of put their answers in, and then we'll go through there. Right now, empowerment and clinical are leading the way. So we'll give a couple more seconds on there and get started. I think I'm going to take a quick little sip in the meantime.
Kate, can I, just while we're waiting, invite all the women orthodontists to join the Facebook group, Aligner Athena Orthodontists. It's a fairly new Facebook group. We have just shy of 200 members already. It's a Facebook group I started. Well, because I wanted a forum where we could talk without being intimidated. That's the honest to God bottom line, where no question is considered silly, or if it's not backed by research, somebody doesn't belittle you. That we have just this safe place where we can say what we do without fear of somebody beating us up, or we can ask a question and it can be naive and somebody doesn't poke fun at us. Um, and so far the response has been really nice. Of course, the larger the group of women, the more interaction that we'll have. And I'm not saying and dissing the groups that have both men and women, but I know from the residents that I have at the U at Minnesota here, some of the females, they read some of these Facebook groups and they're scared to death to even participate, and afraid they're gonna be embarrassed or chided or something. And I just want a group where we nurture.
I absolutely love that. And so that is the Athena Facebook group.
Aligner Athena Orthodontists.
Aligner Athena Orthodontists. I think that sounds like an amazing group. So thank you.
Yeah, and the thing is, right now I'm like the administrator, so you might have to ask to get in, and I'll have to say yes. But the only requirement is that you're a female orthodontist. That's the only requirement. And then there's a thing that you have to click, I think, that says that will be kind and respectful, which I don't think is too much to ask. And I just ask that, and certainly the women orthodontists, I know it won't be an issue, that nurturing comes before ego. And that's all I ask.
No, it sounds amazing. So thank you for mentioning
And
that.
that doesn't mean we always have to agree or do everything the same way.
Right.
But there are kind ways to disagree. And I think sometimes that gets missed.
I could not agree more. So thank you for plugging that and mentioning that, because I think it sounds like a phenomenal resource for every female orthodontist out there. So thank you for creating it. Thank you for making it happen. And I'm not really sure where you find all the spare time to do that as well.
Well, if I don't answer a question and it takes a couple days, you'll know I got a lot on my plate.
There you go.
But, it started to take enough traction that when somebody asks a question, the other strong, experienced lady orthodontists are jumping in. And I don't want it just to be a forum for me to talk to other orthodontists. I really want it to be a group where we talk together.
Wonderful. So again, Aligner Athena Orthodontists.
It's kind of like an everyday one of these.
I love it. I think it's a great idea. So thank you for sharing that.
Well, thank you for starting the idea.
Well, of course. Happy to. These are a lot of fun. People might think they're work, but they're a lot of fun. So I'm glad that we could do them. So let's get to our poll topics and figure out what the people want. It looks like clinical is the number one, followed by empowerment and then business/career. So we're going to go through and hit some of those topics. So I'm going to pop down to my questions in regards to clinical. So who wants to go first with sharing a Propel case that you're working on right now that you're excited about? Does anyone have a specific one that they'd like to share?
I do.
Perfect. Let's go.
So I have this young woman who had orthodontic treatment in the past, congenitally missing a lower bicuspid, a lower left 5, came to the office really, really frustrated because after being in years in orthodontics, they ended up finishing orthodontics, but the lower arch was quite messy. All lingual molars were lingualized, the space collapsed. The primary tooth was a little bit out of the arch and ready to be extracted, tip teeth. And she was very eager to get started and get restorations and get an implant there, open the space. But she was very disheartened because after trying for probably over 5 years to upright those molars and and shape the lower arch. She was not very optimistic about it. She wanted to do something completely aesthetic, class 2 on one side. So we decided I offered her the option of doing a combo case with the clear aligners on the top, start with braces on the lower to give a little arm power to those molars and really get them uprighted and corrected that lingual crossbite and work with elastics. But I told her, like, we need to get this working. And if nothing else works, I'm sure that the orthodontist that was working before was doing all the right things, but for some reason there was extra resistance. So let's add a little magic wand there with Propel and V-Pro both, and let's combine this. We bonded her in March, and I saw her on Monday. So not more than 2 months later, after one session of Propel and vibration, and she was at awe at how much those teeth already had uprighted. And the space was opening up and her bite was feeling very different. And she was actually seeing also the space from the distalization on the upper left quadrant. So it was amazing. But what really shocked me was my assistant's perception. Like my assistant was very shocked and surprised at how amazing this was looking. And I don't know if she's around there in the Facebook group, Gabby, if you're there. Hey, high five to you, because you're an amazing, amazing assistant.
I love it. What a great story. What a great case. Amazing. For
2 months. It was phenomenal. Yes. When she has zero expectation and very disheartened and giving up on her mouth. So
yeah,
wonderful.
I love it. What a great
to see how it continues.
Yeah, we'll have to keep us posted for sure.
Yes.
Does anyone else have a Propel case that they're excited that they're working on right now? Melissa, I see your hand up. Yeah, share it with us. Oh, shoot, we can't hear you.
Now?
Yes.
Okay. Hopefully you won't get too much bounce back. I'm sorry, I've changed microphones 3 times. So I have a really neat case that's been just kind of a long ongoing case. That's an ortho-prost case that I've been working on. I practice with a prostodontist, so I tend to treat mostly adults. And I had a patient that came to me who had been treated by a general dentist for about 7 years and debanded because she was very frustrated. She had an impacted canine that was ankylosed, and after several expose and bonds, they finally extracted the canine. And instead of closing the space with posterior protraction, they took her crowding and shifted her midline 6 millimeters to the right. Oh. So, she still had crowding in the lower arch. I ended up treating her as a 3 bicuspid extraction case and did the 6 millimeter midline shift. And a few months into treatment, the patient called and asked to speak to me because unfortunately her daughter had become extremely ill with pediatric cancer, and they found out that they would be going to Children's Hospital for most of the year. So I said, what can I do to speed this up? I turned to both using mops and a V-Pro. So I did full arch mops for her. I gave her a V-Pro, and I would actually see her every 6 weeks at my office. She would drive 2.5 hours from Children's Hospital to my office on a Sunday. And I hope word never gets out, but I did go into my office and do adjustments on a Sunday on her under the circumstances. But we completed her midline shift, and because they were still in the process of treatment, we went ahead and proceeded with implant placement at the canine for her aesthetics and let her go through the healing process while she was finishing up treatment with her daughter. And there's 1 or 2 little areas that I really, really wanted to touch up, and her daughter is doing fantastic. So now they're coming back home. So in 2 weeks, I'm going to scan her for finishing aligners. And the whole way through, I had her just keep up with the V-Pro, and we used the full mouth mops. So we were really able to move things along for her and to not just completely deband her, when she was going through this tough time. So definitely turning to technology really helped.
That's amazing. And what touching story. I mean, kudos to you, kudos to them for continuing on driving all of that way. You going in on a Sunday. We won't tell your other patients.
Please don't tell my other patients. I let her know she's the only person I've ever scheduled an elective adjustment for on a Sunday.
Yes, yes, that's amazing. Thank you for sharing that.
Definitely.
Does anyone else
Kind
have
words.
something?
That's amazing. It's just the female touch. This shows that you really
Yeah.
care, and considering the hardship that the family is going, instead of adding one more strain to their already horrible situation, it's phenomenal.
Thank you. It's definitely one of those patients that I know I'll remember for my entire career. It's like, they're very kind people too. So it's been a great experience and a great way to really utilize, the tools that we have as professionals to make a difference for somebody in a bad time.
Definitely. Definitely.
Definitely be remembered in their lives as well at this
Mhm.
time for sure too. So it's amazing that we can actually, like you said, we have the tools to do that, but even the compassion.
Definitely.
Yep. Yeah, Jonelle, you're 100% right. Does anyone else have a case that they're working on right now that they're excited about that they'd like to share?
A little bit of a similar story. I have an adult, like I call her our grandmother. She's so sweet, Linda, and she had a lot of crowding, probably where we probably should have taken out 4 teeth, upper and lower, 4 buys. And she, at that time, I had a partner, and so he convinced her that yes, totally doable, take out teeth, and she said, "Nope, I want to start without. Let's try and see." And she started aligners, and about, I don't even think she got 2 months in, she's like, "I can't do this. It's unbearable. It's painful. Like, I can't." And so my team came to me because I seem to be, I don't know, they're heirs of all reason. And then when they leave, I'm like, great, why did I promise to do this? How am I going to do this? So I said, let's try some Vipro on her. And she really, really wanted to straighten her teeth. She's probably about 70. Linda's the sweetest little thing. And I will never forget it. She tried it, and she called me in tears saying, "Thank you so much. Like, this made a world of difference." She's like, "I can now change my aligners. It's way more comfortable. Like, I feel so much better. I can continue." And now that we've debanned her, I saw her recently, beginning like March, maybe February, for a retainer check. And to this day, she is like thrilled. The smile's beautiful. Like, she talks about it all the time. She's just one of those people that will be a raving fan forever. And just when you see like, oh, why did I take that on? Why did I do that? I feel like I promised something that I can't deliver. But just knowing that that one little thing that casts a lot of doubt on people's mind that may or may not work, and then you use it and it's totally successful for you, it's amazing. It just goes to the lengths that we'll go to, and just how creative we can be sometimes. Determined.
Determined is the perfect word for it. Determined and nurturing and compassionate. I mean, that's, you said she's having pain. What can I do to make this better for her? And you didn't just say deal with it. You took the next step. So amazing story. Thank you for sharing. Now, Regina, I'm going to put you on the spot.
Yes, ma'am.
Uh-oh. Yeah, I know you have a lot of wow moments, and you've shared quite a few over the years, but especially over a lot of our Zoom events the last year or so. What's a more recent wow moment with Propel, Vipro?
Well, I have two.
Okay.
At
And then
least.
maybe share a little bit of how you've integrated Vipro into your practice as well.
Yeah. The first story involves some families that have multiple people in treatment. For example, I'm treating a mom or a dad, and I have the little phase 1 of their kid. So we have several families like that now. And I've had probably 3 different families come in asking for extra mouthpiece for their Vipro, because we don't, or hadn't in the past, really thought of it for the phase 1 patient, right? And the parents have been using it and have been so impressed with it that they've been washing the mouthpiece and letting their child use it. and got tired of that, and then came in and wanted
That's
to
love.
purchase extra. Well, you know, I reached out to you and asked if I could buy more of the mouthpieces, and that's why. So my mind is going, just from a comfort standpoint, that these kids feel like it's more comfortable and the trays seat better, that maybe it shouldn't be an afterthought with these, you know, younger growing patients, and not just for, you know, the teens and the parents.
Mhm.
So that was kind of an aha moment. And then another story I have, it's kind of fun because I think one of the stories I shared probably a year ago was, maybe it was the first meeting we got together, but anyway, that doesn't matter. The case of the mother of the groom that came in, and she had an anterior open bite, not horrible, some minor crowding in the front, and she'd already had 4 buys out and had ortho as a young person. And she had had a consultation in town here, and they had told her it was going to be jaw surgery. It was going to be over $8,000. Remember me telling you this story, Kate?
Yep. Yep.
And there's no way that it's going to be done in, you know, like 11 months for the son's wedding. And so she got very disheartened, and she was a friend of somebody that had already been in our office. And she came in and she said, you know I can't get it perfect. I'm going to give up, you know, trying to correct my bite, but can you at least make my teeth straight by my son's wedding? And I looked at her and said, I don't think we have to give up fixing the bite. I think we can do it all. So, you know, we did aligners with, you know, an open bright protocol, the 5-day changes. Sometimes it was 4, sometimes it was 5. We were kind of a little loose on that, depending on, you know, how passive it felt. The V-Pro, and she sent me pictures that she had taken at her son's wedding. She doesn't have the open bite. She's got a big, broad, beautiful smile. And those are the really warm aha moments. Fast forward this week, I had somebody that knows her, a young woman, come in whose wedding is in like 5 months. And they had run into each other. And she was telling this older mother that her only regret is that she hadn't had her orthodontics touched up. Again, 4 bicuspids out, no open bite, but just some anterior crowding. And that now she didn't have time, and she didn't want to run the risk of not having the braces off before her actual wedding. And my other patient said, honey, you got to go see Dr. Blevins. She's got this magic thing that you bite on that speeds it up, and you'll probably be done by the wedding. So I want to call this other lady up, the first patient, and go, thank you, but no pressure, you know. But I did tell this young gal, I said, we can make a vast improvement by your wedding. I can't promise you we'll be 100% done, but it's going to be broader. You're not going to lead with your 2 front teeth. And when she turned sideways, you know, it was narrow, and then these 2 front teeth. I said, it may not be perfect, and we probably will have to do a touch up after the wedding. But if we like get started today, I think you'll be quite, you know, thrilled with how far we'll get. So that's the kind of fun stuff you've brought to my life, Kate.
Well, I'm glad. I absolutely love it. And I mean, honestly, that's a testament to you with the first woman where you said, I don't think we have to sacrifice the bite. You figured out a way to do it all. And I think each of you on this call, you know, whether it's balancing being an orthodontist, running a business, running a team, being a spouse, being a mother, a daughter, whatever it is, as women, we figure out how to balance it all. And you did that for that patient.
I've got a new quote for you, Kate.
Ooh.
I was thinking about this. It's not about thinking outside the box. It's about throwing out the box.
I want that mug.
And I wish
Melissa, who makes all of our dreams come true, I hope you're hearing that one.
I wish I could take credit for that, but I don't know who originated that quote, but I had heard that somewhere else. But
That's a great one.
but I think women in our field, well, in many fields, that get to the level that the women are in this group, we've had to think outside the box since we started college. Even I know when I started college, it was thought that you went to college to find your husband. Okay, it wasn't about focusing on your own enrichment and degree in your career, and then starting your own business. Why would you want to do that? You want to be a mom. Well, it's not easy, but you can do whatever you want. It doesn't mean it isn't hard work, but you don't have to dial back your goals and your dreams just because it fits in somebody's box.
I couldn't have said it better. Yes, thank you.
My daughter has to listen to this stuff all the time.
Well, and that's why she's such an amazing kid.
Yeah, well,
What can we say? I think so too.
How old is she?
My daughter will turn 26 this December. She's a fourth year dental student, also in the PhD program. And sometimes I just shake my head. You know how you see your kids kind of being a mini you, she's my mini me, except one whole notch higher on the ladder, So.
Well, you're both amazing. Does anyone else want to share any other? Liliya, yeah, please go ahead.
My wow case came during the pandemic when we were closed. So in New Brunswick, we were closed completely, couldn't see any patients for 8 weeks. And just before we closed, so the end of February, I started treatment on a young lady, 2021. So I live in an area of Canada that has a lot of class 2D bites. And this young woman started out with 11 millimeters of overjet and 100% impinging overbite, skeletal class 2. And we had discussed options for surgery, and she had declined, and we were doing the best we could with clear aligners to correct the overjet and the overbite as much as we can, and the crowding. Very proclined upper incisors with a large diastema between the front teeth. And so it really, aesthetically, she could use a huge improvement. And this is a girl who didn't want to smile, didn't want to date, never had a boyfriend. This comes up during the consultation because she hates her smile. Oh. And so we started clear aligners and elastics. I use a protocol where I start them on class 2 elastics immediately at the first appointment. And at the same time, she gets a V-Pro. I don't do mops. I would like to, but I don't yet. And then we close. And so I see my patients during the pandemic. I started seeing my patients virtually. So we're doing a Zoom appointment, and I ask her to bite down, and she bites down and the class 2 is gone. And I'm thinking, oh, she's just posturing her lower jaw forward. This is not possible, but it's great because your smile is really amazing and the space is closed and this is perfect. And it's only been 11 weeks. And I'm sure that your jaw has come forward just because of how the muscles are and the elastics. So just continue to do what you're doing and I'll see you in the office. So I see her in the office at 12 weeks and the class 2 is corrected. And the overbite is 10%. And so of course I think, oh, it's a shift of the lower jaw. So I'm going to take you off of the elastics just to see how much the lower jaw is going to relapse while we continue to wear aligners. And I leave the buttons there just in case, knowing that she's going to come back and the overjet's going to be 8 millimeters and we're going to have to start the elastics again. And she comes back in 2 months and the overjet is 2. And the overbite is corrected. And her Invisalign aligners are finished. And there's nothing left to do. And no one can believe, like I can't believe it. My team can't believe it. And she's thrilled. And so we finish treatment and I say, oh, by the way, I'm going to give you retainers. You're going to wear your retainers every night. But keep in mind, your lower jaw is going to go back and this is all going to relapse. I just saw her for a 1 year. I don't usually do a 1 year retainer check. I actually never do a 1 year retainer check unless I want to check the bite because I'm afraid of relapse. And she still has a class 1. And she is engaged. And I just, I'm thrilled because I know the science behind V-Pro, and I understand the the mechanics of tooth movement, but that amount of skeletal correction in a young adult is really impressive. And I can't attribute it to the V-Pro, or maybe it's a combination of the V-Pro and the aligners and the mechanics and the way maybe she had a little bit of lower jaw growth left. But that really opened my eyes to promoting non-surgical correction of class 2 in adults who are not open to surgery.
Yeah, that's an amazing story. Sounds
And
like
you
a very
know,
good case.
the science is so far behind the clinical process that we're doing. And as long as it's not harming anyone, I don't see the problem with offering those kind of treatments like that, because if you didn't try that, you may not, well, you may have seen it anyway because she might have just had a great growth spurt, but you gave it everything you had in your toolbox to give her an ideal result and did nothing that would cause her any harm. So I say kudos to you. You know, you got me thinking now that maybe I should emphasize that in those class 2 div 2 cases, you know. I had a thought about div 2 cases one time because I've had a couple of them grow really well. And sometimes I think that the div 2 anterior is trapping the mandible and, you know, really inhibiting the growth. So it's like, as soon as you start to get overjet, it takes off. And whether or not the vibration would enhance that or speed it up. Yeah, it's a possibility, but I certainly don't think it would hurt anything, you know? When you bite on that, I don't know if any of you have ever done that yourself, but I certainly have. You feel that all the way back in through your joint area, you know? And I'm a clencher. I thought it felt really great. But, you know, whether that would stimulate that growth plate back there, that's an incredibly interesting idea.
I love it. New ideas coming even to everyone on this panel.
A university research project, class 2 div 2s, you know, whether they're treated with aligners or fixed, it probably wouldn't matter that much, but using the V-Pro and seeing, you know, with a class 2 correction appliance, whether you have better correction with or without the vibration. It's you know, an interesting, because you've shown that you do get bone remodeling, you know, and osteoclast activity. So does that translate to the growth plate as well? It's an incredibly interesting question.
Yeah, I love it.
I personally think that the aligners help because they disclude the bite. Right? You're no longer
that certainly could be a factor too. So
and it allows the muscles to relax, almost like I've never done that with my patients, but people who do tense on the muscles.
Yeah.
And suddenly the lower jaw comes forward, sort of like a similar idea.
So like in the plus column for a class 2 div 2, you've got untrapping the mandible by proclining the upper teeth. You've got aligners to almost make a flat plane-ish kind of splint to disclude, and then vibration, maybe stimulating at least blood flow, if not cell activity in the joint area. That's interesting.
Yeah, I love it. I love new ideas coming to each of you. Anyone else want to throw out, Jonelle, Kristin, to either you have a case or want to share how you used it, or should we move on to empowerment questions? I don't want to cut anyone off.
I mean, I can quickly talk about one of my.
Sure.
I think I always, when you think of my WOW case, can you hear me?
Yeah.
I just think back to one of the early cases I did. And it was, it was a mandibular shift with a posterior unilateral crossbite. And so we figured out, we got midlines lined up, and you got a posterior, open bite on the side. And it was no doubt an 18 to 24 month, really difficult case. And he, from start to finish, I think was 8 months. And that was when I was in, very early stages of using VPRO and not quite ready to say how much time it could shorten it. And I was just blown away. I still pull up his pictures to this day, and the midlines are dead on, the shift is gone, no cross bites. It's just, and when people ask, and I'll get cases with posterior cross bites and shifts all the time, and they say, "You sure you can do this? And you sure that fast?" And I look at them, and I'm like, "Well, and I'll show them the dates on my software where it was start to finish." And there's no doubt that I could have done that without VPRO. So
I love that. Wonderful.
I've got so many weddings too. All these stories happen every day in my office, but that was just my first kind of aha moment. This is, practice changing. So.
Wonderful. Well, thank you for sharing it. I appreciate all of you sharing a moment and a story. So thank you all for sharing them. So now I want to go to, and Regina, I know you already shared a new quote with us, but I would love for each of you guys, if you can, to answer this one. What advice would you give to a younger you, or to young women entering the ortho industry in general? Something you wish you would have known? Who wants to go first? Melissa? Do you have one you'd like to share? We can't hear you.
So if I could go back, even definitely to the start of residency, if not back to the start of dental school, or if I could talk, to many young female orthodontists, I would tell them to be unapologetic for your success. Unfortunately, I was trained in an environment where women were not treated with equal respect and dignity that men were treated with, and you were made to justify anything that you did, any success that you had. Even when you leave and you get into private practice, it's like there's always the pressure on you to kind of justify what you've done and how far you've come. And I think there's something that women are not taught, to be proud of themselves and to be proud of what they've done. And, when you have to deal with male colleagues that unfortunately are sometimes not supportive, I think that you need to be they're certainly unapologetic for their success. Why shouldn't we be? So I think that that's something that needs to be stressed to young female professionals overall.
Yeah, it's,
I love
not
that.
to
Thank you.
diss guys, because, in all fairness, they're not here to defend themselves tonight.
True.
But, and some of my most dear friends are male orthodontists. And there's jerks in every profession. Okay, so let's just put that out there. And when I say jerks, that's genderless to me, but men are taught to be confident, and other people look at somebody like that and go, wow, that's a really confident, successful, whatever the profession is. Women that have that same aura, traditionally we're thought of as bitches, and it's not fair.
Yeah. Or they consider you arrogant.
Yeah. And several years ago, I just said, I'm not buying into that narrative anymore. It's none of my business what they think of me. And I just don't care anymore.
Yeah. It's, and Melissa, I think I want to say that we talked about this, or I mentioned something like this when we did our live event at AAO in Los Angeles. I think is where it was. There was a study done. I'm going to mess this up because it's been years since I've looked at it, but I want to say it was at Yale, where they interviewed a group of women versus a group of men who scored well on tests. And all of the women said, or a high percentage of them said, I worked really hard. I busted my butt. I studied like crazy. And the men, even if they did, said, oh yeah, I didn't study at all. Went well, went great. And you're exactly right. It's ingrained in us. And it's so, that's great advice to tell them to basically brag on themselves, have the confidence. I love that. So thank you.
And, you know, I am hoping another generation, we won't even have this conversation anymore. I don't know if it'll happen that fast. I've seen tremendous changes in the 30 years that I've been in practice. My original dental school experience was probably 20 of us gals in a class of say 120 or 30. We didn't even have a restroom on the lab floor. We'd have to go up to the patient bathroom on the clinic floor. And it was not hidden at all that we were not welcome. We were certainly invading the turf. And fast forward, my daughter's class is the first class at Minnesota that's over 50% female. So, you know, the tide is swinging.
That's wonderful. Wonderful. Who else has a piece of
Oh,
advice?
it's funny. Back to that. I went to dental school first time around in Argentina in the 90s. And dentistry was actually a profession where the majority of the students, and it was over 60% female in dental school, because it was thought to be a good profession for a woman because of the flexibility on the schedule. Look at that. Instead of an empowering great field to get your dreams and work hard and succeed, it was okay. Yeah, you can take your maternity time off and you can finagle your schedule around so you don't have to really work when you're working. So it was even messed up like that. But now today, many years later, I have a daughter who's 12 years old, and the whole narrative is different. There's no gender specific achievements or capabilities. It's like, what do you mean? Everything is the same. It's not okay to say that this is girly or this is for men or this is for women, female or male. It's amazing how their view is completely different than ours. And it reminds me, I don't know how many, it was a few years ago, there was this commercial, I think for a deodorant or for something. It was like the run like a girl or fight like a girl. They were asking, filming people, okay, pretend like fight like a girl. And they were like, oh, like very stereotypical, not strong. And then they ask little girls that are 9, 10, 11 years old, and they just really go and fight it. And they give everything they have. And it's great that they don't bring onto themselves that external limitation.
Yeah.
So I think those boundaries are being broken.
Perfect. Who else has a piece of advice for young women or a younger you entering the ortho industry?
I would just say that, you know, that to believe in yourself, that you didn't get this far by luck, and that I agree with Regina. You have to be confident. You see it a lot, that I even still get challenged by some of the male parents, as if I'm like, sometimes they look at me and they're like, did you just start? I'm like, thank you. That's really sweet. Nope, but I've been in this about 10 years. So, you know, like I do know what I'm doing. And it's, my team says that, it's funny, they got me this mug for Christmas that says I've always been essential as bleed. And so when you say that, you know, you look back and you think, wow, your team looks up to you because you drive this confidence. You drive the narrative in your office. You don't put up with that. And you come into this office, you need to be respected. And you have to respect that my treatment plan or my views are my views. And I'm just as good as the person next door or the man down the street. It doesn't really matter. You're going to pick and choose where you want to go. That's fine by me. So I think I'll say probably the same thing. Like, don't be unapologetic. Be as confident as you can. You didn't get this far, and you can anyone else.
I
Yeah,
love it.
I in my main office, I have a dental hygienist that's phenomenal treatment coordinator. Happens to be male, and when he will tell them that his name and that he's a treatment coordinator, and then he will scan, take the records, and do a simulation on the iTero, really bright, and then says, this is almost intelligence, the AI. We're going to get the real intelligence, and Dr. Blevins is going to come in here and do the formal exam, and then she'll tweak the simulation to your specific case. And you'd be surprised at how many people go, oh, I thought you were the doctor, right? Even though
Yeah.
introduced himself as a hygienist, that's a treatment coordinator, and it's just funny, it's funny.
It's like I stand out in my clinic, right? I mean, I'm tanned, and the girls all wear black. I wear colors. Like you cannot miss who's who, and I cannot tell you still to this day where I get parents calling mad. Oh, the doctor didn't see my kid, and I'm like, I think it's pretty obvious if I'm in a blue jacket, royal blue, like bright pink, teal. I'm like, we just had a lengthy conversation and your child didn't see the doctor. Sure about that?
Oh my goodness.
So never gets old.
Yeah, I've been called the nurse in the white coat. Okay, that works for me, I guess.
So how do you,
I've had assistants who were much older than me, and the parents would turn to them thinking that they were the doctors and I was the assistant.
Yeah.
so how do you ladies shake that off at the end of a day? How do you shake that off so it doesn't bother you?
Oh, you don't get where these ladies are without having a little bit of thick skin.
There we go. There we go. I like it.
The way we
What
handle
else?
it in our
Okay.
the way we handle it in our office is my husband actually tells everybody that he's my assistant, even though he's the prosthodontist.
Oh,
So
I love it. That's perfect. That's perfect. Any last pieces of advice that you guys would like to share before we move on?
I would just say take every day, one day at a time. Because I think, I caught myself a lot of times looking forward and this is what I want, and this is what I would do. And then I thought, oh my gosh, how am I ever going to be able to do all of that? But it just all works out every day, have a new shorter goals, in addition to our long-term goals, but keep an eye on the immediate and the present.
No, I think that's great advice. Take one bite at a time.
Mhm.
And always never forget to have good sense of humor.
Oh, yeah.
Laughter is always a good thing, and you cannot get through anything without
Yeah,
a good spirit and good laugh.
Shaking off some of those, I don't even want to call them insults because they're not really insults. It's more coming from a place of, I don't want to say ignorance either, but you get what I'm saying? People just are unaware, maybe.
Stereotypes.
Yeah, they stereotype without thinking, and not to take it home, not to let it ruin your day. Like Yael just said, got to let it roll off and laugh about it. That's really otherwise, that whole mindset wins, and it takes away a piece of you, and it's not worth it. But I don't mean not educate them. You got to make a joke out of it. Let them know who you are. Have that confidence so that they're impressed with you. They're like, oh well, yeah, that is the doctor, I guess. But don't take it any, and let it eat you up inside. That's not worth it.
Yep, don't let it affect you and ruin your day. I saw something earlier today, or maybe it was yesterday, that the only person who can ruin your day is you, by letting someone else ruin your day. So I try to do that when I'm having a tough day, where I'll say, nope, I'm not letting you ruin my day. So thank you all. Liliya, did you have something you'd like to share as well?
My piece of advice is along the same lines. It's don't compare yourself to other people, because your journey is very different. If you want to compare yourself to yourself a year ago, 3 years ago, 10 years ago, and it's really it hits close on social media, because women are more on social media than men, period. We're just more social. And so it's very easy to scroll through Instagram or TikTok and see someone whom you respect and you admire, and they are far, far, far. What they portray is where you want to be, and suddenly it's that pang of, I'm not doing something right, or I'm inferior, and maybe I'm the only one who gets that. My piece of advice is, take a screenshot of your practice management software from a year ago. Take a screenshot of your social media account that you manage from 2 years ago. And that is what you should keep track of. It's the improvement of yourself, because your journey is very different from someone else's. The same thing with, Invisalign provider status, or whatever other ways we compare ourselves to people, the number on the scale. It's only, you should really only be comparing yourself to yourself.
Or just don't own a scale.
There you go.
I don't. I fan them in my house. They're not allowed in my house.
I think that's great, Melissa. And Liliya, I think that's phenomenal advice. So thank you. I think everyone can relate to that, to where we all get stuck in that tunnel of comparing ourselves to everyone else's highlight reel on social media. And it's so important to not do that. Know that everyone else they have their own path, and what they're showing might not be their real world. And maybe you have something that you're excelling in and something you're struggling in, and vice versa for the other person. So thank you. I think that's a phenomenal one as well.
And even if it is their real world, I'm happy for them.
Yes.
Right? I don't, they have a bigger house, a bigger practice.
Good for them.
Your car. More power to them. I celebrate them,
Exactly.
Is,
Yep. And that is why you all are a wonderful group of women to have on our Women Empowering Women series. So that right there just shows you. Okay, I'm going to move on to technology for our last section. Let's see, I'm going to choose a different one. What technology have you integrated into your practice that makes your life, your staff lives, and your patients' lives easier? What do you guys love?
First, please.
Yes, go.
I go second.
Just add me in somewhere along the line.
2 things. One, our aligner initial delivery got to be a really long appointment, because you're not only teaching them how to take their aligners in and out, you're going over home care. If you're using the My Invisalign app, you're talking to them about that. You're talking to them about virtual care photos and how to use your retractors. Oh my gosh, it got to be like this deer in the headlight look, because you were throwing so much at them. So what we decided to do is pare it way down at that initial delivery appointment, We still put the attachments on, do our initial IPR if that's planned or whatever. Make sure they can get the aligners in and out, and that's it. So what we've started doing is having a 1 week virtual appointment with one of our dental assistants. A week later, it's worked out phenomenally because they've had them a week. They know what questions they have then. They go through downloading the app. They practice taking their first set of photos. They put their new set of trays in. So that's their first tray change. And the assistants that I've had doing those say that all the patients are like, oh my God, I thank you so much for checking in with me after a week. You guys are the best. They really feel taken care of, right? And the virtual photos and stuff, it's not like, whoo, they're so like overwhelmed that just, oh my gosh, I can't do it. And they're taking these photos and things in the environment that they're going to be doing it at home. So they can troubleshoot all of that. So it's really, we've been doing that now for about 3 months, maybe. It's just been a game changer. The other thing is now they know they're doing virtual appointments, right? So let's say a 48 tray case, we've been doing the 1 week virtual, then another virtual halfway between that first appointment and the middle. So I'm seeing them back in the office at about 24 weeks. Then another virtual midway before that, between that, and then back in the office at the end. It's been an incredible game changer. But the patient perception is they're getting watched every week.
That's amazing. So
it's
3,
really
4
good.
appointments, a bunch of aligners, a V-Pro, and a bunch of virtual
Yeah,
appointments.
Yeah,
That's
it's
amazing.
like a whole package.
And still a
But
full
that
case fee.
that first week check-in really set the stage for them adopting that whole technology package, you know, and, you know, how's the V-Pro going? You know, are there any sharp edges on your aligners? All of that has really worked out really well. We also shot a video of like video wear and care instructions. So we don't even have to talk to them about brushing their aligners and stuff. We give them the information for the YouTube channel. And so at that 1 week, you know, it's like they've been told to watch that before their virtual appointment. So did you watch the wear and care video, you know, and all of that. So that's been a game changer. The other game changer is I have a 5D plus iTero now. And it's got the NERI technology. We've been getting patients coming in now that see us first. They haven't seen their dentist or they don't have one. And we're picking up some interproximal caries and things. So now I'm getting calls from dentists thanking me for referring patients to them.
That's amazing.
Yeah, so that it's kind of nice to be the one in the driver's seat with the general dentist going, oh, thank you for this referral of this family. And you know, so I like that.
For Tracy for getting that in your hands. That's amazing.
Yeah.
Good for you guys. All right, Yael, you're up.
Actually, this is a shout out to Regina.
Uh-oh.
No, this is amazing. This changed my life in a week. I was at your Invisalign webinar a few weeks back, and one of the pearls that I took is buying that battery charger for the iTero.
Okay.
Oh my goodness. Now I can move it from room to room without having to turn it off, unplug it, replug it.
For $49, right?
Nothing.
Yeah.
Amazon battery charger.
Have you tried a mouse on it yet with the little clip-on table?
Not yet.
Oh, if you
I'm good with the fingers. I can handle it, and I found it the way I thought it was brilliant also, but that battery, man,
well,
that was.
If you do simulations on phase ones ever, and you have to open space and you have that little thing you got to click, 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 click.
Yes.
For me, the mouse is easier to use, but I'm glad you like the battery. That's fun.
That was the biggest hack, best hack I've had, and I'm all about hacks. I love it.
I love it. That's amazing. Who else has a life hack or an ortho hack?
I don't even know. I feel like you do it so often, you don't even know it's a hack.
It's a profession
anymore.
about hacks.
feels
We
so-
just have to get creative and finagle our way into getting the correction we want.
Yeah.
Like the space is not closing, get some O-rings, put a floral composite, make an instant bracket and a power chain.
There you go. Innovative.
Yeah.
Melissa, I think you had one.
Well, I guess if it's coming to hacks, I have all types of things. My husband and I, we like build custom carts for our intraoral scanners. I like to think of things as I have lots of high-tech tips and low-tech tips. My low-tech tip is that I take any boxes that I have for clear aligners and I write myself the notes and instructions in the lid so that when I open it up, I don't forget anything. That way I'm like, just writing those little notes like on a cheat sheet on the side. But as far as technology, I really encourage all orthodontists, and especially all the female orthodontists out there, to just embrace the digital revolution. I was one of these people, I was very resistant to technology years ago. But my husband, who's a prosthodontist that I practice with, when we moved to a rural area, he's like, we don't have labs. We don't have a digital center. We don't have anything at our disposal that we would be used to in a big city. We have a cone beam. We have 4 intraoral scanners. We own 13 3D printers because my husband just keeps buying them. And I have just embraced a lot of the in-office clear aligners workflows. So I will work with major aligner companies, especially for really big cases when I need lots of aligners. But when I have a difficult case, a really tough case, or even just a simple relapse case, if I just need a few aligners, or in those incredibly complex cases where I need ultimate control, I go to the software and I design them myself. I 3D print, we make them in office. It's changed my perspective on clear aligner treatment. And if there's any ladies out there that want to really dive into the digital workflow and they don't know where to get started, I write free articles and blogs that I post online. And, to Regina's point of, creating a positive environment like she's done with her Facebook group. There was only 1 or 2 Facebook groups online that were talking about doing the in-office clear aligners workflow. The one that I was interested in was completely run by men. And if I posted something, they would take it down. When I reached out to the admins, they were very, well, okay, we'll let you post. And I would post something and they would take it down. And I realized they had no intention of allowing people to openly and freely share their thought. And anybody who's going to suppress women's voices, I'm not going to tolerate it. So I started my own forum where I even have lab techs there, because if you want to learn how to manufacture something, you ask a lab tech. And it's just free information for all to share. And I just said, you know what, if somebody's not going to let me play in their sandbox, I'll make my own sandbox.
Good for you.
There
So
you go, girl.
I encourage everyone. Like I was, if you met me 10 years ago, I would be like, send everything to the lab. I don't want to manufacture anything in my office. That's why I didn't go to pros. I'm tired of smelling acrylic when my husband's mixing it. I don't want anything to do with that. And after being in it, I can't practice without it. So just, lots of information out there.
What site you have?
So my free articles and blogs are posted on learndentistry.com. And for any restorative dentists out there, my husband writes, for every one blog I write, he probably writes 5. He wakes up in the morning and he'll write about 3D printing and intraoral scanning too. We have tons of videos out there on YouTube, all free and accessible. my Facebook group is In Office Clear Aligners. So, but Learn Dentistry is the website, and you can read about it there. And yeah, you'll see. I'll openly admit that my husband and I literally sit around at like 8 o'clock on a Friday night or Saturday night when we're at our lab, sometimes even 11 o'clock at night, because we don't have kids and we're just at the lab together, geeking out, doing what we want to do.
That's perfect. You're creating your own sandbox and then you're playing in it.
I created my own
kudos
sandbox.
to you.
So
I love it.
now there are times that I wish that it was a little easier to maybe not be such a workaholic, but I think I've had to embrace what I love, and I love my job and I love my career. So it's become my sandbox.
Girl.
Yeah.
Yeah, exactly.
Yeah. Well, see, I'd rather go to the office and play with a new intraoral scanner than clean out my closet at home any day.
That's okay. There's
It
nothing
is.
wrong with that. There's nothing wrong with that. Well, thank you all so much for all of those technologies and products. And I think the moral of the story, Melissa, with wrapping that up, is just embrace it. Embrace new technologies. Get experience with them. Try them out, because otherwise you're not going to have any other way than knowing. So
Get rid of the box.
get rid of the box. Throw it out.
And ask a friend or colleague if you're concerned about making the investment on something. Go to a friend's office that has that technology and go play with theirs,
100%.
go check it out. I think, so many of us are open to sharing our thoughts and ideas. If you're, interested, Regina has lots of hacks, I'm sure, and you're sharing them now on Facebook. That's kind of the beauty of social media, that we can share openly our ideas and our little hacks and our tips and tricks together.
Definitely. And, if for anyone who's watching, go to Learn Dentistry, go to the Aligner Athena Orthodontic Facebook group. I'm sure there are other ones. Feel free to reach out to me. You can call Propel and say, who is that lady that was on Facebook the other day? And I'll put you in touch with other female orthodontists so that you can all connect and continue to learn from each other and empower each other and make sure that we're making it a great place for everybody. So thank you all. Oh, go ahead, Regina.
Yeah, I just wanted to invite anybody that might have an interest. Right now we're in the middle of a course that I put together called AIM, Aligner Implementation Management. And it's just the digital workflow from the new patient phone call to retention, basically clear aligner focused. And we've had the charter group about 4 months ago. We're in the middle of the second course, and we'll be offering it again in September. But it's more process-based versus actual, how to do a CLIN check for a particular kind of malocclusion. But any of you out there that are looking at being maybe more efficient, or the tips and tricks on how to have the digital workflow maybe go a little bit smoother and things like that, we'll be offering it again, probably signing up in August for it to start in September.
I love that. Thank you. And you actually, Regina, you beat me to the punch, because we have covered, no. We've covered so many amazing topics tonight. And although we could probably keep this conversation going for hours, I think everyone still probably has some wine left too. We have just a few minutes before we wrap up. So because I know a few of you, this is your first time connecting with each other, and a few of you, it's your first time being on one of our Women Empowering Women events, I wanted to see if anyone had any questions or comments for the other panelists. So amongst yourselves, or if you have any women-owned businesses that you want to plug, obviously other than your orthodontic practice. But Regina, I appreciate you sharing, your group and your courses with everybody. But any questions or comments for each other, or businesses you want to plug that you love? One of the ones I love is Figs. I think that their scrubs are amazing. So it's women owned. I think it's wonderful. That's one that I would throw out there. I don't know if you guys have any others.
I can throw one out there. I've been really impressed by CareStream Dental. I have one of their intraoral scanners. A lot of their training team is female, but their CEO is female as well.
Wonderful.
And actually the majority of their senior leadership and management team is female. And they did a great series this year on women in dentistry for Women's History Month in March. So just a company to kind of keep an eye on to see, you know, they really, you know, promote female leaders within their field. So
That's amazing.
Our outside lab, Partners Dental, is a husband-wife team with a real strong woman and as a partner, and very responsive, you know, for, you know, making palatal expanders and different things like that, Mars and things like that we use them for. But
Perfect. Thank you. Thank you. Thank you. And I know there's also some amazing female consultants out there in the ortho industry. Lily, I think you guys use one that you've loved quite a bit, right?
Lori William is incredible. She's really, she's in Canada, and she's really changed the systems in my admin systems, especially around insurance and collections, accounts receivable. Those are the topics that I'm not very strong in at all.
And that's okay.
After 8 years of owning my own practice, I brought Lori in, and she really changed things around in a way that wasn't aggressive or pushy, or didn't really, she was more like a team player. She didn't stress any of my team out. She was on their side just as much as she was on my side, and there was no sides. So really a very human, female, caring touch.
and what was her name again?
Lori William with Strategics.
Yeah, she's awesome, actually. We used her too when I first left residency and moved to Alberta. We used her in the practice that I was in at first, and we remained friends for a very long time. And when I bought my first practice, it was female owned. And so you're right, she has this dynamic. She's just amazing. She's a little firecracker. She's very creative. She's come a long way in the world, and I think getting into offices, especially that were male driven, but still just knowing how to place, you know, the equal balance on the platform, and just being that, you know, that sounding board for a lot of people. Like my staff still remember her quite a bit too. So yeah, I think she's quite awesome, actually.
Wonderful.
The last thing I'm going to say about her, my team thinks that she's their best friend, like literally would text her with family updates. And we haven't seen Lori in forever because Atlantic Canada is completely blocked. We cannot have people from outside. We cannot travel out. And so we're in this little bubble. And they still keep in touch with her without my knowledge. Now, I feel that Lori's my best friend. And she keeps it completely private and completely confidential, and it's really wonderful.
That's amazing. That's wonderful. Well, Kristin, Jonelle, Liliya, thank you so much for joining us for your first Women Empowering Women event. We appreciate it. We would love to have you all come back. And then Yael, Regina, Melissa, thank you for continuing to support us. Very, very much appreciated. So I would thank you.
Trying to center that. Thank you.
Thank you.
Yes, yes. And I want to thank each of you from the bottom of my heart for taking time out of your night to continue your efforts to encourage women to empower women. I mean, that's what we're here for. And you guys have all given us great advice, great quotes, everything tonight. And so each of you have contributed, not only tonight, but honestly every single day, to make the industry and frankly the world a more inclusive place. So thank you, each of you, for that. Again, very much appreciated for that. And with that, I want to thank again, everyone, and wish you all a happy and safe Memorial Day weekend. Cheers to another wonderful Women Empowering Women event.
Thank you, and cheers to all.
Thank you all.
Thank you.
Thanks.
Good night.